Today I want to talk about the car ergonomics, and I want each of you to have this sheet. You should be able to download it through the link, or that you already have it. I'm Dr. Sarva Patan, and I am the owner of Personalized Physical Therapy and Wellness, and I want to go through the very important car ergonomics. So let's look at number one. The number one is the seat height, and you're looking at the distance of the surface from the seat, from where you put the feet to where you actually sit. And you do want the seat height to be exactly where you can see the fenders as well as you can see the road. You want to be a safe driver for others while you're a safe driver for yourself. Along with that, what I also noticed is a lot of people are trying to scan the road like this, and that's the clear indication that the seat height is not appropriate. It's not high enough. It's not tall enough that you're having to scan the road like this. You should be able to comfortably see the road as well as the fenders. Let's look at number two, is the adjust the backrest. So backrest, you want the backrest to be at 110 degrees. So if this was parallel, you want like about 110 degrees. The reason why I say that is if you're too far forward, that puts a strain on your back. If you're too far back, that's very strenuous for your lower back also. And the 110 degrees is like the normal curvature angle for your lumbar spine to easily put the force down the spine and transfer the weight. The third is the seat forward, and what you're looking at is your feet distance from the seat. You do want to be able to easily reach the foot pedals, the brake pedals. You shouldn't have to like reach too far forward, which puts the strain in your sciatic nerve and puts the strain in your lower back. You want to be able to easily and comfortably reach. Number four is the head restraint. And so you're looking at this head restraint part in the back, and what you want is you want it to be right behind the back of the head. Head restraints are designed to protect you in a case of accident when the head actually gets thrown back, and you want it to be able to support the head and prevent the head from just flinging back off your body. And the next is number five, is the tilting the seat. So you want the angle of the seat to be where the knee and the hip is parallel. If the knees are too far high when you're trying to like lounge and drive, that puts a lot of stress and pressure in your hip joints, may lead into hip arthritis. I'm sure you may have experienced when you're coming out of the car, you may feel some discomfort and hip tightness. That's coming because you've been keeping the knee too far close to the body. You want to have nice and level, or even knees below the hip level, because that also allows the curvature on your lumbar spine to stay in a normal fashion. And the last point that you're looking at is the steering wheel adjustment. And so you want your steering wheel where you are not having to reach too far forward. Quite often, a lot of my patients complain of discomfort on their neck right after they're driving. And so what I notice, I ask them, where's your steering wheel distance? And they're like driving like this. What that does is it puts the strain on the neck muscles that you're constantly using them while you're driving. You want to have them fairly relaxed, elbows bent, and not too close either, because again, in the case of accident, you don't want to like hit the head on the steering wheel. You want to have them relaxed and keep all of these muscles fairly relaxed and normal. So if you go ahead and practice all of these 6 points, make sure that your car has all of the adjustments that you should have. And if you have any questions, let me know. Thank you for watching.